I recorded my hair growth every day for the last 7 months after shaving my head and getting a hair transplant from one of the best doctors in the US.
But did he come to me? Well, we gotta check on this. I don't think so. So yeah, they have these like lines on the low forehead. I'm not really sure what these dashed lines indicate. Maybe they were trying to figure out symmetry with those dots. And then I can see where they place the hairline. They're using this type of jagged line, sort of like zigzag method. It looks a bit straight there, but they didn't drop that hairline too low from what I can tell. So that's good. So this is day 0. And yes, while they're augmenting the hairline, he also has this thinner appearance to his mid-scalp and his crown. And so I'm curious to see, did they transplant that as well, or are they relying on medical therapy and maybe addressing that in a secondary procedure? Let me see if I can tell from the side view how far back they worked. Okay, here at day 7, you can see these like cracks in the road, we call them. And that is what happens when some crusting settles in and some of the crusts actually pull the hair shafts over to one side and you can get these little cracks in the road. That's a normal type of appearance. That's okay. Now, from what I can tell, they transplanted the frontal scalp, but they also put some grafts into the mid scalp at day 7. At least part of the crown may have been addressed. It does look like they did a pretty large number of grafts to those areas. Remember, for some of these procedures, they're done over 2 days so that you can extract a large number of grafts in day 1 and then you come back and do it in day 2. In my clinic, personally, we like nice long single day procedures and then we wait to see the progress and then we can better plan for a secondary procedure if needed. But some people like to go forward and do like a Hail Mary approach in 2 consecutive days and bang out 5,000-6,000 grafts. That's not my approach. I really care about optimizing the healing of the donor area, but for some people that works fine. So here he is applying some topical solution. He has some redness in that donor area. It looks like he's taken a pill, probably finasteride, I would hope, to try to prevent any further loss. The area is now starting to get more dense as he approaches 6 months into the process. He's showing different views at 210 days. But you can see when he looks down, overall things look more dense. And it takes time to see the final result. So it's going to be at least a year until it all grows in. But again, this is one approach, is to just kind of go for it and put grafts throughout the entire central scalp that has thinned with time. My approach is usually, if I'm going to work on such a broad territory, to divide the surgeries into 2 separate days, usually about 9 to 10 months apart. But I understand that some people want to get it done in a single session. And that's okay too if it's done safely and in the right hands. So again, there's a different approach for every person, and you have to do your homework to find the right fit of surgeon who best understands your goals and will deliver great results in a safe way.